answered this before when I talked about consistency, compassion and common sense, and making sure that as a government we have COVID-safe plans to attend things like a funeral, for example, or to be able to go see a loved one who is dying, or to be able to go and make sure that if you have to go from Brisbane or Queensland to Sydney to get life-saving operation, then it is taken into consideration. Of course, we must always follow the health advice and keep Queenslanders safe, but we always must show consistency in the decision-making. You've touched on it. Celebrities and sports stars got a free ride, but others didn't. And that is the lack of compassion that I believe that has been shown. In relation to the Chief Health Officers, I've actually said what I would do is this. I would direct the Chief Health Officer or ask the Chief Health Officer to create a COVID-safe plan for situations such as you've pointed out.
Okay, Premier, do you have any regrets in terms of, situations like Adams? I guess
these are very hard.
People not going to funerals?
These are very hard situations. I know how difficult this is for people. But I have to take the health advice. I have to take the advice of the medical experts, the medical practitioners. I'm not a medical expert. And what we have done is a couple of things. The first thing is that we created that border bubble between the communities, the border communities, which I think has helped a lot of people. And during that time, there have been over 300,000 exemptions for that border bubble. Secondly, Queensland has granted the largest number of compassionate exemptions, over 1,100. And when we started hearing these tragic stories, I asked if they could actually enhance that response unit in health. And we now have over 110 people there working. But why do we have exemptions? We have exemptions because we had a strong policy on the borders to keep Queenslanders safe. And the best news I hear every morning when I wake up is when we have 0 cases. And that is because of the tremendous effort that every Queenslander in this state has done.
But Premier, have you had any second thoughts at times when you've seen the sort of heartbreak that has been alluded to, Adam's difficulty? Would you see him through the same scenario again? Of course it's heartbreaking. Like, I know how hard it is when we had to, when we had an outbreak here in Queensland and we had to do contact tracing and everything. Our hospitals had to be locked down and our aged care facilities. You know, for a long period of time, people couldn't go and visit their loved ones in aged care facilities and in hospitals. I have an uncle who's going through treatment at the moment. No one in our family could go and visit him while he was in hospital as well. I understand how difficult these situations are. But I'm just saying we have to listen to the health advice, and we are trying to make it as easy as we possibly can for families, but it is very difficult.